try this one more time. I'm going to wait until I get the thumbs up this time from these people over here. Is the audio working or not? Oh, it's working. All right, see ya. Now I can talk about myself. Thanks, guys. Okay. Too bad I can't trim the video. We're going to talk today about stenosis. If you've got low back pain, this is the most common type of back pain. So it affects millions of people. Millions of people have stenosis. We're going to talk about what it is. So first of all, what is stenosis? Well, stenosis means a couple different things. It has a couple different names. Arthritis is a name of it. Degenerative disc disease is also a name of it. But the actual term is called stenosis. And what that means, that's a Latin term for narrowing. There is a hole that we're going to talk about in the spine that narrows. The deal, though, is that in this video, I'm going to talk about what it is, how I can tell you right now if you have it or not, and also what causes it. And then I'm going to put a link in this video on an exercise you can try that addresses the most common cause. So this is a great video. It talks about everything we can talk about as far as what is stenosis. So stenosis means narrowing. There is what's called a clinical predictor rule, which means that there was a study done on lots of different tests and measures and questions, and they came up with 4 questions that I can ask you right now, and if you answer yes to all 4 of them, there's a 97% chance that you have stenosis, or that's the reason that that's the type of back pain you have. Now, don't get caught up with the type versus the cause. Here are the 4 questions. Do you have back pain when you're standing? Are you over the age of 50? Do you have back pain when you're walking? Does that back pain go away when you're sitting down? If you answered yes to all 4 of those questions, there's a 97% chance that stenosis is the type of back pain that you're dealing with. Now, the problem with that is that if you remember a couple weeks ago, I did a video talking about how there was a study done looking at thousands of people that had MRI, actually hundreds of thousands of MRIs of people's spines without any pain. And what they found out was over the age of 60 years old, or at 60 years old, 80% of people have stenosis in their spine without pain. So it's nice to know what type or what's going on with the structure of your spine. But we're going to talk about what actually causes it so you can find a solution and not have to get an unnecessary surgery. Right? That's the goal. So that clinical predictor rule, if you answer all 4 questions yes, that is an indicator that 97% likely that you do have stenosis in your spine. Now, what is stenosis? So I'm going to try to show you this image here. I'm going to scoot over a little bit. Here's a nice ugly picture of a lumbar spine segment. So this is one bony area. That's a bone. Here's a bone. In the middle is a disc. The disc is more like crab meat material if you're younger. You can see right here the yellow part is actually a nerve. That nerve comes out of a hole. The hole is not, that's what we're referring to when we talk about stenosis or narrowing. The thing that most people don't understand is that hole is actually a dynamic hole. It's actually made up of 1/2 circle is from the bone up here, and the bottom half circle is made from the bone down here. That hole narrows as we get older, but the hole is dynamic. And that's important because that means that when you're moving, the whole diameter is changing. It's getting either more narrow or it's opening up with certain movements. So that's important. Stenosis just identifies that the hole is becoming narrow over time. It doesn't mean that the hole is permanently narrow or that there's nothing you can do about it. So let's talk about, there are 3 ways that the hole closes down, okay? And there are 3 movements that you do. So the first one that's the most important is when you extend backwards or lean back, that makes the hole smaller, okay? Nerves don't like a small hole. So we want a big hole. Now, so number 1 is extending backwards. Number 2 is if it's the right side, each side of the spine has a hole where the nerve comes out. If it's the right side, when you lean to the right, that makes the hole close down on the right side. But it makes the left side open up. Now, the third way to make the right side more narrow is to turn to the opposite direction. So if it's my right side, when I turn to the left, that makes my hole close down on the right side. Now, I can do them individually or I can do them all together. So if I went extension to leaning back, leaning to the right, and turning to the left, that closes down the right side of the hole maximally in all 3 planes of motion. It's one of the reasons why golf is so difficult for people. When you do your follow-through swing, you're extended, you're leaning to the right, and you're rotated to the left. So that closes the right side down maximally. Now, what's good for one side or bad for one side is not necessarily, it's actually doing the opposite on the other side. So those three motions actually gap open the left side. So they open up the hole. So it's important to recognize that the hole is dynamic. As we age, the diameter of the hole does get narrow because of aging, but motion actually either opens up the hole or closes the hole down. So it's important to identify which one of the three ways does your spine not like to do. So extension is probably the most common one, leaning back. It's why you see people that are dealing with stenosis, the type of back pain, they usually like to lean forward, leaning on the grocery cart when they're walking. It's also why that clinical predictor rule, number 4, when you sit down, your pain goes away. Because when you sit down, that flexes your spine and opens up the hole. So it makes a ton of sense when you think about it like that. Now, extension, leaning backwards, is the most common problem. And this is actually the most common cause. So most people will blame their spine. Oh, I have stenosis, I have back pain. Guess what? It's not your back's fault. It's your body's fault for making that hole smaller than it's supposed to be, right? So it gets smaller and more narrow as we age, but the people that have no back pain yet have stenosis, the study I talked about a few weeks ago, the reason they're not having pain is because the other parts of their body are moving good enough to not close that hole down maximally, right? The most common cause of back pain that from a person that has stenosis or an aging spine, I like to call it aging spine because it's just like the skin. Our skin ages, that's normal. We don't get a skin replacement when we get wrinkles. Most people don't. So we know that the most common cause for somebody with stenosis that has extension-related pain, or they can't stand or walk because they're having pain, or they have pain when they stand or walk, is actually because of a muscle in the hips. So if you see right here, I have a nice diagram. This muscle right here comes, you can see it's anchored on the spine, so it attaches to the spine. This is the front of the spine. And then it comes down and actually anchors to the hip. So right now when you're sitting watching this video, at least I hope you're sitting, you're not driving or walking, this muscle is totally relaxed as well as your spine is flexed and the hole's open. When you go to stand up, however, if this muscle is a little bit tight, it's going to start to pull the spine, and it actually pulls the spine forward. And when you pull the spine forward, that causes the spine to extend backwards, like we just talked about, one of the 3 main ways to close the hole down. So this is a muscle called the hip flexor. And it's very, very common to be limited in motion, very tight because we sit more than we should. And if we have tightness here and we stand up, and then especially when we take a step forward, because now it really has to lengthen, because it's now the leg is behind me and it's really pulling on that spine, it'll make your spine arch or extend back, and that closes down that hole and causes the nerve to get compressed. When that nerve gets compressed, or well, if the nerve gets compressed, you're going to have pain, like nerve pain, sciatic pain, but sometimes it's just the spine itself, so you'll have pain right in the center of your spine. Those joints are actually getting compressed, and there starts to be joint inflammation. So stenosis means narrowing, the number 1 type of or diagnosis of back pain, but here's the number 1 cause. So it's not good enough just to say, oh, I have stenosis in my spine, it's aging, and I need to have surgery. By the way, the most common surgery is a spinal fusion, where they actually open up the hole and they fuse it open. The problem is you lose motion. So the reason that only 50% of people are less painful 2 years after that surgery is because the segment above and below now have to move more. And since their spine is aging and they have a narrow hole, those segments moving more are more likely to cause pain. So surgery is really not the best answer there. The best answer is to figure out what parts of the spine below or above are causing that hole to close down more than it's supposed to. And by far the most common cause is tightness in the front of the hips. When we stand and walk, remember that rule, the 4 questions. When we stand and walk, that muscle pulls on the front of the spine, causes the hole to close down in extension, which is one of the 3 ways that can close the hole down. And then we have back pain. And pretty basic, pretty easy to fix. Just got to find out. Now there's a lot of other causes. There's many causes that would contribute to that hole closing down. This is just one of maybe 1,000. But I've given you in this video, right below this, there's a link for you to try an exercise or a movement to try to loosen up this puppy so that you can get less closing down of that hole. And and hopefully you can avoid medications, you can avoid injections, you can avoid surgery. Please avoid surgery. And I hope you enjoy this video helping to teach you about back pain and find natural ways to heal your back pain.